Our other big story today out of Corewell Health, they've announced that visitors are being restricted to the pediatric units at 3 hospitals because of increased levels of respiratory illness. So here is who it impacts. So it's the pediatric units at Dearborn, Royal Oak, and Troy. Only 2 visitors during the day and 1 overnight for patients. And it impacts patients that are 21 years old and younger at the pediatric inpatient unit. So we want to bring in Dr. Frank McGeorge to give us a little bit more perspective on what we're looking at. What does it take level-wise for illness, or how does a hospital measure it before they put these kinds of restrictions in?
So every hospital has different levels, thresholds that they react to, and it has to do with bed capacity more than anything. So there's 2 issues, infection control and bed capacity. In this particular case, according to Corewell, actually, it is actually related to bed capacity. So when we see a surge in respiratory illnesses, more inpatients are, or more people are admitted. When there are more people admitted, there's basically less room to put visitors, and so we limit the number of visitors, or they will limit the number of visitors.
What are we seeing in terms of the levels of respiratory illness this time of year? I feel like I'm hearing so many people are down with some kind of illness.
Yeah, there's been a lot of coughs, a lot of run-of-the-mill colds. There's in the pediatric population a fair amount of RSV, but honestly, in terms of influenza and COVID, it's basically about like flat, maybe slightly increasing, but it's certainly nothing at a critical level yet.
So when we have this kind of situation at Corewell that they put out there right now, is this rare, or is this a commonplace sometimes?
No, this is standard operating procedure in many ways. I mean, we probably haven't seen it in a couple of years this way because we're so used to having that COVID interval, but actually this is something that happens most respiratory seasons. Pediatric hospitals will begin to basically limit the visitor numbers because the inpatient census increases. I wouldn't expect, in fact, I would say that it wouldn't be surprising if other hospitals followed suit in the next week or 2 or 3, depending on their volumes as well.
Okay, so what should parents and kids be thinking about when it comes to RSV and just kind of helping prevention and talking to their pediatrician?
Well, if they haven't already been vaccinated, so, if you're elderly, that's an indication to be vaccinated. If you're pregnant, that's an indication to be vaccinated against RSV. And there is actually an RSV monoclonal antibody that can be given to, at this point, somewhat higher risk children. And I say that because it's in relatively low supply. But all told, vaccine is number 1, and then there's this common things: wash your hands, stay away from sick people, stay home if you're sick, that kind of thing.
Stay home if you're sick. That is a big deal. All right, thanks, Dr. Frank McGeorge, for giving us a little clarification on that. All right, good stuff. Stay healthy, right?
Yeah, thanks.
All right.